Welcome to Parent Squad, everybody. I'm Felicia Lawrence, and today's hot topic is one that affects a lot of families. We're talking about ADHD. I'm joined by Dr. Melissa Hord and Dr. Gabby Rodriguez, clinical psychologists at Riley Children's Health. Thank you so much for being here. We know that this can be a challenge, but a little bit of balance can help go a long way. So what is ADHD? Let's define it first, and how does it impact? I think people usually know what the acronym stands for, but can you define it and how it affects children?
Absolutely. So ADHD stands for Attention Deficit Hyperactivity Disorder, and it actually comes in 3 different forms or subtypes, if you want to call it that. So the first one is kind of a hyperactive subtype. That is where kids have a hard time sitting still, they're up and moving around, they really need to move, and it's something that they feel very strongly. Sitting still is almost impossible for them. And then there's another subtype that's called inattentive, and for that, kids lose things, misplace things, forget to do things, just get off task and kind of forget what they were doing. And then there's also a third one where kids can have both. They can have both the hyperactivity and the inattentive. And what's really interesting is it's easier to see the hyperactivity because you can see when a kid is moving around. But when they have the inattentive subtype, it can actually be hard to see it. So sometimes those kids don't get caught until a little bit later in life because they weren't causing, a disruption to anybody. Yeah. And so it's hard to know.
Certainly. And do you find that it looks different in boys versus girls?
Yes, definitely. And boys tend to get identified much more frequently and a lot earlier than girls, and partially because that hyperactive subtype tends to happen a little bit more frequently in boys, and so girls tend to have more of this inattentive subtype. They're a little bit more kind of the space cadet type of thing that we might see, and so they're not as disruptive, and so they tend to get identified a lot later in life. There's a lot of adult women who actually get, suddenly figure out, oh, I think I've had ADHD my whole life and I didn't really realize it. And so we really want people to kind of be aware of this and be on the lookout for ADHD in girls. Sometimes it can look like anxiety or it can look like something else, but really what's going on is this kind of inattentive ADHD.
And to really drive it home for people who don't have this experience, it's just the inability to regulate that? I mean, what is actually happening in the brain of someone that has this?
So, and what happens is there's a part of your brain that actually helps you stop and think before you do things. It helps you with that impulse control. It's also what helps you organize things. It's what helps you plan. And that part of the brain for some kids is just not growing as quickly as other kids. Like most brain development kind of follows a typical pattern for the vast majority of people, but for kids who have ADHD, it's just a little bit behind. So the good news is that that part of the brain is going to keep growing, right, until about age 26. So they will still get better at a lot of these things, which is great.
Nice, because you want them to be able to function, obviously, and as a parent, you want to help them have this level of independence in their lives. What's some of the best ways to do that?
Yeah, there are a lot of things that parents and caregivers can do to support their kids with ADHD. And so that's one of the things that we do in our clinic is help parents and caregivers just learn lots of different strategies. Lots of things like helping with routines, helping to figure out things like how do you set up visual schedules to help kids remember, okay, here's all the things that I need to do to get ready in the morning. Things like figuring out, we were talking about this alarm clock that we learned about recently where you have to actually get up and scan a QR code in a different room to get out of bed because a lot of kids with ADHD struggle to get out of bed in the morning. We talked about things like maybe having something like a playlist. So a lot of kids with ADHD struggle with time blindness. So they may be in the morning getting ready and suddenly 45 minutes have passed and they're like, whoa, where did the time go? And so setting up a playlist that's the same songs every day. So I know when Crazy in Love by Beyonce plays, that means that the bus is about to come in like 5 minutes. So that means that I've got to put my shoes on, right? And so having kind of the same routine every single day can be really helpful. But these are not things that kids are going to set up on their own, right? And so parents and caregivers can really support kids in setting up these types of supports and this kind of scaffolding so that these are things that kids can really continue to do throughout their lives. And so if we set them up while they're young, help them practice those as they go, then those are the types of things that they can really continue to do forever.
Oh, certainly. And what I got from that is just the level of creativity that comes with trying to support your child and do something like this that I think is weaved throughout all of parenting, but especially if you're navigating a specific diagnosis, then you got to be creative in your solutions. That's what I kind of gathered from that. Okay, what would you say though to the people sitting at home? Some of the things you described, I think a lot of people would relate to themselves or see that in their child. Difficulty getting out of bed. I mean, that's not easy really for anyone, I imagine, to get out of bed and be somewhere. And then, of course, I think you mentioned time just passes and all of a sudden you might be rushing out the door or something like that. I think some people would align with that. How do you know when it crosses the more serious threshold of needing to get help or checked or something like that?
Yeah, so what I would say is, I mean, a lot of the things, and this is, I think, the case for anything in mental health, there's lots of things in mental health that a lot of us might identify with, one symptom here, one symptom there. A lot of these things happen on a spectrum. It's not just autism that's a spectrum. Yeah. And so really what I would say is that when we call them a disorder is when they're really causing impairment in our daily lives. And so, you know, if getting out of bed is hard, you're absolutely right. Getting out of bed can be hard for a lot of us. But if getting out of bed is something that's difficult for you in such a way that is causing you impairment, in combination with lots of other things that are inattentive, you know, related to inattention, related to hyperactivity or impulsivity that are causing you significant impairment in your daily life across multiple settings. And I would say that's getting to a point where you probably should talk to your pediatrician, to your child's pediatrician, or you can talk to your child's teacher and hear a little bit about how that might be impacting them in the classroom or in other realms at school. And then, you know, have the conversation with pediatrician about, you know, should we get an assessment? But really impairment is the key. When it's causing impairment in somebody's daily life, that's when we start to think, okay, this may be crossing over into what we would call a psychological disorder.
And I like what you're saying. You can start with the teacher, you can start with the pediatrician because they've been trained to at least know when. They're probably not the person that's going to treat your child, but they've been trained to know when to get you to see someone. Exactly. Where it might be a little bit more serious. Or they have seen so much, then they can at least weigh in. That's what I found with our pediatrician, is that she's seen a lot in her career, so she can at least point you in the right direction depending on what it is, or help you reframe something. Because I imagine it's sometimes difficult for parents to get to that point where you don't even want to say the word. You know, you want your child to just be, of course, healthy and normal. And so to get to the point where you got to share.
I do want to add in one last thing about that, because I do want to be clear that having a hard time getting up in the morning isn't a symptom of ADHD. It just seems to kind of correlate for a lot of the kids we work with. I think it's kind of a double whammy when you get to adolescence too, because we know that all teenagers are biologically driven to stay up later and then not want to get up in the morning, right? So if you have a teen who has ADHD, you're really going to get hit with it a little bit harder, right? Then those mornings are just rougher. We know that we don't know exactly why mornings are harder for kids who have ADHD. We know they struggle with transition, so that could be part of it. We know they can kind of hyperfixate on things, so maybe they're just hyperfixated in their dream. I don't know. We don't really know for sure, but we just know that.
And school starts so early.
It does start so early. It's true.
Yeah. So Dr. Hord, can you start the conversation with medicine? What does medication look like for this disorder? Is that what you refer to it as?
Yeah, we do define it as a disorder. So we don't prescribe medication, but there are stimulant medications that are very commonly used for ADHD, and there's also non-stimulant medications. One of the really nice things about ADHD-specific medications is that they get into the system really quickly, and they also get out of the system really quickly. So you can know very quickly if that medication is going to give you a negative side effect, and then also stop it very quickly, which is nice. That's a really good thing about the medications.
How do you help kids with administering the medication, or is that something you see in your practice that they don't take it, or do they forget to take it, or do they want to take it?
All of those things.
Do forget to take it, yes. So one of the things, so we work really closely in our department with folks who prescribe medications, so psychiatrists, nurse practitioners. There's also folks who are pediatricians or family medicine practitioners who prescribe. And so a lot of times we work closely with them to help families help their kids remember to take the medications, because of course one of the symptoms of ADHD is this kind of forgetfulness. And so we work with families to help come up with some kind of ways, kind of mechanisms to help remember to take the medication. So we'll use pill boxes, right, and things like that with days of the week. And one of the things that's important for parents to remember is that it is not really developmentally appropriate to have most kids remember to take their medication on their own, kind of regardless of whether they have ADHD or not, if they're a little kid, but especially for a youngster with ADHD. And so it's really important for parents to really be the ones who are in charge of making sure that the medication is on board. And you know, we really say, like, stay there until you see, like, did they take it, yes or no. It's not just a matter of handing it to them. It's like
in the pocket.
And because it might go in the pocket, and then it's like they might have intended to take it, but then they just forgot, right? And that is oftentimes what we see. So we talk with parents about, like, give it to them and make sure that you watch them take it. And then, you know, so that's the type of conversation we will have on the kind of behavior side in collaboration with our prescribing colleagues.
Okay, parents, that's our job, to help our little ones get it together. What's your advice to parents who say, my kid is just still too loud, they just won't sit still? What would you say to them?
That they need to move. They really need to, and that they are going to be louder. And I think for a lot of the parents I work with, we almost have to just get to a level of acceptance. Because there are areas of their life where they're going to have to hold it in, right? When they go to school, they're going to have to hold it in, and that's going to be really hard for them. So at home, you know, I think it's actually really good for them to be allowed to get that out, to be themselves, to be loud, to move around, get that big energy out when they need to.
Yeah, and I love the words that you're using, because labels and the words that you use are certainly important, especially as we're talking about our children, because we want to try to be as positive as possible and, you know, speak goodness into them. You mentioned something earlier, and I think you said girls tend to, sometimes it turns up as maybe a space cadet or a space. Was that the terminology?
Well, that's what I say sometimes.
Yeah,
I think
casual.
It's funny,
well, the reason why I liked it, because it leads to my next question of how you turn some of these challenges into strengths. And so again, that goes to labeling it correctly, because we want to speak positively over our kids. But what's your advice for parents in terms of that?
Oh, well, there's so many things that can come out of having ADHD that actually lead to strengths and things that are positive. I mean, we both have chosen to work with these kids, right, on a daily basis, because we enjoy them.
Yeah, they're the best.
They're the best. They're so fun. There's so much energy. They get things done really quickly, even into adulthood. Can really be a taskmaster. They can multitask. They're fun. They're energetic. They're sociable.
Yeah, they have so many friends, and they, I think, can be really good leaders.
Yes.
And just so many, and this is not, you know, to be clear, we're not minimizing, of course, that there are challenges that come for people with ADHD. So we're not trying to say that, you know, for folks who are watching at home, like, we're not minimizing, like, yes, if you're experiencing ADHD and that's coming with challenges for you, of course that is the case. And we want to have, I think, a balanced approach of, and the other side of that coin is that there are strengths that come with it too, right? And I think we try to take that approach with anybody that we're working with, is there are challenges and there are strengths, and we're going to want to highlight both of those and address the challenges and try to encourage the strengths. And so there's just, lots of things that we think are strengths of kids with ADHD. And for us, they're really fun.
That is so wonderful. Are there some other resources out there for parents that they can be paying attention to?
Yeah.
One of my favorites is understood.org. They have lots of really, really fun articles on lots of things: how to work with schools, how to ask school for an individualized education plan. What's the difference between an individualized education plan and a 504 plan? How do you talk to your kids about using social media, especially if your kid has ADHD?
Yeah.
Anything under the sun. And one of the things that's really good
I feel like
about
that's
this,
a whole probably semester of your training
my goodness.
just in that in itself.
Absolutely. And one of the really good things about it is that everything that's on that website has been vetted by a professional. And so you can really trust that that content is accurate and it is evidence-based.
Nice.
So that's one resource. And I think you really like another one.
Understood.
There's understood.org and I think Child Mind.
Mind.
Yes.
Child Mind?
Yes.
Okay, Child Mind. Okay,
Childmind.org.
a couple resources for you. Thank you so much. I mean, if you are navigating a diagnosis, let's not let it be a scary thing. Let's arm ourselves with information so we, of course, can be our best selves for our children to help them become their best selves. Thank you both for being here. We appreciate it. If you do want to learn more, we've put all this info on WTHR.com/Parent Squad. Stay right there because we have much more to come.